Hello, how are you? My name is Abdurrahman Mouza. I'm from Indonesia. I'm from the Medan in North Sumatera. North Sumatra. Uh, Today, I'm going to bring the topic about general aspect of the hydrocephalus in Adam Malik General Hospital in Medan from 2019 to 2020, a demographic study. So the introduction, the overall global prevalence for hydrocephalus is approximately 85 for 100,000 individuals with significant difference between different age group. The prevalence of the infant hydrocephalus is roughly one case per 1,000 birth, but this is probably greater in developing country. In Indonesia, we conduct the study in Indonesia. The incidence in hydrocephalus in 2013 was around 40,000 2016 to 80,000 55. Okay. So hydrocephalus in pediatric population is characterized by an initial increase in intraventricular pressure, resulting in pathologic dilation of the cerebral ventricles with accumulation of cerebral spinal fluid. The cause of hydrocephalus vary, but two broad subsets of the condition exist in nomenclature. One is communicating, two is non-communicating. They are differentiated by whether the normal anatomic flow is preserved within the cerebral ventricular system. Clinical presence varied with age. In infants, hydrocephalus presents with abnormally intrinsic head circumference, irritability, vomiting, bulging of the anterior fontanelle, or splaying of the cranial suture. Our method is total is 155 patients collected from medical bank data of Neurosurgery Department Faculty of Medicine of North Sumatera, Indonesia. Here we collected the data of gender, pathology of hydrocephalus, main symptom, Glasgow coma cell on admission, the growth of age from the patient. The pathology is we divided by four categories: meningitis, tumor, spinal bifida, and congenital. Data complete using the SPS 25 edition. So this is our data. Our data is symptoms is uh, uh, many of the symptoms is increased head circumference 53. The second one is the loss of consciousness 31 and 30 a seizure 25 and other headaches and vomiting is 8 and 8. So how about the gender? We do that, like we can see that 62% is boys, 38% is girls, and the pathology is all of the 75 people we do is congenital, 27 tumor, 45 meningitis, and 8 spinal bifida. How about age? We do our study is uh, many of our patient is 1 to 40 years old. It's 87 patient, and below the 1 years old is 47, and the others is 8, like 5 to 9 years old is 8 patient, 10 to 40 years old 8 patient, 15 to 70 years old 4 patient. What about the Glasgow coma scale? We do that 114 patient is 13 to 15 gauges Glasgow coma scale. So our result is boys have total 66 patient, 92.6%, and the girl with total 58, 37.4%. Most of patient with chief complaint increasing in head circumference on total of 53 patient, followed by seizure, loss of consciousness with total 30 and 31 patient respectively. Headache and vomiting with total of 8 patients, and other symptoms presenting a lump on the back, fever, loss of sight, irritable, and failure to drive. We found that most of hydrocephalus is caused by congenital cause with total number of 75 patients, followed by meningitis with total 45 patients, tumor causing 27 patients in total, and spinal bifida with 8 patients. Group of 8 mostly affected in first or 4 years with total of 87 patients, and least is 15 to 17 years old with total of 4 patients. GGS out admission is the highest in range of 30 to 15 with total patient 114 with 74%. This is our discussion, and Nabawi et al. Showed that 100 patients, 62% were males and 38% were females. It's same with our data with male to female ratio 1.6 or 1. Family historical congenital anomaly was positive in 26% of patients, while hydrocephalus was positive in 14%. 72% patient has congenital hydrocephalus, 87% patient were full term. Macrocephaly was diagnosed or not at birth of patient, 32%. The study showed that US finding of hydrocephalus was positive in 49% patient. So Zal et al. Showed that a total of 170 children with benign external hydrocephalus were included. 86.4% were by boys. At birth, the head circumference was close to normal. Mean age for when the head circumference reached abnormal value, like example crossing 2 percentile or reaching the 1975 percentile, was 30.4 months. None was older than 7 months. Around 4 of 5 children had dilated lateral ventricle in addition to enlarged subarachnoid space. The neuroimaging finding tended to normalize after age 12 months. So, on my study in January 2016 to December 2018, 287 patients with a diagnosis of hydrocephalus underwent surgery, presenting 93% as congenital cause, and 36% acquired with predominance of males. Most common sign with patient attended with consultation was macrocephaly. Infectious dysfunction was 10.1% versus mechanical dysfunction. Mortality was not related to hydrocephalus. 100% death was associated with systemic infection and 0.6% with a respiratory infection. As a crucial recurrence that acute presentation hydrocephalus after cranial fault as close as clinical emergency that requires neurosurgical consultation. However, in some cases, particularly in neonates, the treatment can be deferred while the infant grows, becomes more able to tolerate surgical procedure like CSF shunt. Ventricle VP shunt is most common type of shunt. Is usually grant CSF from lateral ventricle to the peritoneal cavity. In children, it has advantage that the distal peritoneal part may be left long and will not require changing during the growth of the child. ETV is indicated in case of aqueduct stenosis where the fourth ventricle alignment is absent. Conclusion mostly in our data is mostly affecting boys. Head circumference may be bigger and ultrasonography can help diagnose this illness. An infant with open fontanelle can be screened by ventriculomegaly by cranial USG, but an MRI study is preferred rather than CT because MRI avoid radiation exposure and provide more information. It's typically indicated to elucidate the anatomy and cause. VP shunt is the most common type of shunt. Thank you, my friend. I hope this short presentation it will be bring our new information about our province about hydrocephalus. Thank you very much for this opportunity. Assalamualaikum warahmatullahi wabarakatuh. Thank you.